an emergency service that's struggling to serve in emergencies. Growing with England's hospital waiting lists are the stories of people who've called for an ambulance and waited hours, like Mary Jane LANNI, whose 87-year-old mum fell one evening and hit her head.
So he arrived at 7:45 the following morning. So I think that's the total of 10.5 hours he waited for the ambulance.
Then there were another 10 hours inside the ambulance, outside the hospital.
I believe the hospital, the A&E department, is so pushed that they're using the ambulances, the back of the ambulances, stretchers as an extra ward.
As well as individual stories like Mary Jane's, there are stories told by data. So here's a stat for you. If I'd fallen ill or got injured in England in November and taken myself off to accident and emergency, there's a strong chance I would have been one of nearly 40,000 people that had to wait more than 12 hours to be admitted to a hospital department. Now that is a 355% increase on the same figure from the previous November. According to the Royal College of Emergency Medicine, delays like this are costing 300 to 500 lives every week. The causes? Pinch points and blockages, 2 full wards and staff shortages.
We also recognise the big pressure that we're seeing played through in terms of ambulance handover delays is largely triggered by those who are fit to leave hospital but delayed in doing so, and we need to free up that bed capacity.
But ask pretty much anyone involved with the NHS why this much cherished national institution is so critically ill, and they'll tell you this.
What we're seeing is the result of 10 years of underfunding, understaffing and under-resourcing the NHS. What the pandemic has done is it's aggravated the situation.
The system, insiders say, is now brittle and unable to flex with the seasons or surprises.
Many winters have been challenging, but what we've seen this year is that the usual level of winter pressure that we might see would usually abate in the summer. You'd get a bit of a respite, you'd be able to do more work, and then the winter pressures would come again. But this year, it became so pressured that the whole summer felt like winter level pressures. So then when we got to winter, we were already at a much higher baseline of pressure.
When will the NHS get better? Will it get better? The doctor's prognosis is gloomy, not for many months and not without serious financial help. RORY CHALLANDS, Al Jazeera, London.